Hello everyone, thank you again for joining me for another Instagram Live. I've had a great response to my fertility lives that I've been doing with Melbourne's top fertility experts. And I thought I would continue with the same theme tonight on a topic that I think is really important, but I think that a lot of people don't actually know too much about. Tonight I thought we would talk about egg, sperm, and embryo donation and surrogacy. For some people, getting pregnant is a very straightforward process, but for others it can be really quite complicated. And tonight I'm delighted to be joined again by CREI-qualified fertility expert Dr. Raelia Liu, who works as the Director of Women's Health Melbourne and also as one of the top specialists at Melbourne IVF. As I said, tonight we're going to talk about gamete donation, embryo donation and surrogacy. And I see a large number of patients who need these different things in order to get pregnant because my practice is inclusive of all women and families wishing to become parents. So I'm going to see if Raelia is available now to join us, and we'll get chatting shortly. Hi Raelia.
Hi Scott, how are you?
I'm very well, thanks. How are you?
I'm really well. I'm
Good.
really
I can
well.
tell you've done these before because I always find it very easy to add you into the conversation. How's your weekend been?
Yeah, it's good. It's good. Sorry, I'm a bit in casual mode. I've been in mum
Oh,
mode
not a
today,
problem at
which
all.
has been
Absolutely.
a
Had,
lovely day.
definitely had some downtime this weekend.
Yeah.
Brilliant, fantastic. Well, I was just saying that tonight I think is a sort of a topic that a lot of people don't know too much about.
Yeah.
And admittedly, I'm keen to learn about what you have to say tonight as well. I care for a number of women and different couples who have either had gamete or embryo donation or are gestational surrogates. And it's always sort of a very special pregnancy to look after, I think. And I am hoping that tonight we'll be able to shed a little bit of light on the process for all of the people who may need a little bit of extra help in order to achieve their pregnancy. I suppose from a simple point of view, you need a healthy egg, a healthy sperm and a healthy uterus in order to have a healthy pregnancy. And for some people, either for fertility reasons or anatomical reasons, it's not so simple. So I thought tonight we could start with donor sperm. I know that on your wonderful podcast, Knocked Up, you've done a talk on donor sperm, but I thought it might be a good place for us to start. So which groups of people come to see you as a fertility expert potentially needing access to donor sperm?
Sure. So look, I'd say a minority of the patients that I treat with donor sperm are in a heterosexual relationship where there's absolute male infertility, although that remains one indication. The
Right.
vast majority of my patients using donor sperm are either single women wanting to have a family or same-sex female couples wanting to have a family. And the options are to use either clinic recruited sperm donors, of which Melbourne IVF has a large number compared to many clinics,
Yep.
or alternatively a known donor, which is a little bit more of a complicated getting ready process, but certainly also a good option. So
Yes.
I've helped couples in both those set of circumstances, heterosexual couples who absolutely need donor sperm. The reason that is rare is because IVF is very well targeted to even the most severe male factor infertility. So really when we're needing a sperm donor, it's a rare situation to overcome male infertility, but it does happen.
Sure.
Same-sex female couples, more and more common, having babies, having families, so many ways to form families. And in terms of same-sex couples, often they'll have one baby with one partner's egg and the
Yep.
same donor, and the subsequent child with the other partner's egg and the same
Yep.
donor. That's a very nice way of doing things.
It is so many different permutations.
Yeah, absolutely. And then more and more women are getting to their, late 30s, early 40s, and potentially maybe not in a relationship, but
Yep.
still determined and ready to become a mum. And it's absolutely
Absolutely.
possible to treat women
Definitely.
in those circumstances too.
Certainly. So in terms of actually accessing the donor sperm, I know you say that sometimes they're clinic recruited. Some people, use friends of theirs or people that they know. For women who want to access clinic sort of recruited donors, how does that process work?
So the first step is to see a doctor associated with a clinic that has a donor program. So, for example, if a patient wanted to see me, they'd make an appointment to talk about their options.
Yep.
And there may be more or fewer options depending on a woman's age. Often donor programs are quite strict in the women who can access donor sperm for artificial insemination. And the criteria we have at our program is that's available to women under the age of 40 years.
Right.
After that, we tend to use IVF. Mainly for prognostic factors all round. And while it's not an absolute set in stone rule, that's generally the experience of most women, that if over 40 accessing donor sperm through a clinic program, they'll be taken more down an IVF pathway. With a known donor, it's much more flexible. It's much more flexible. And, the kind of cold hard logic to the clinic programs restricting access to donor sperm is, even though we do run active campaigns to recruit sperm donors, there's a limited amount of donor sperm, and logistically for a donor to donate, they're going to come and donate several times, but there's a limited physical amount of donor sperm, and it's really rationed based on prognosis. And you need a lot less sperm for an ICSI cycle than for an artificial insemination. So that's what those restrictions are based on.
No worries. And when it comes to the donors themselves, what will the women accessing the donors know about the donor?
Yeah, so there's a profile about the donor, and sometimes there might be a childhood photo of the donor, not an adult photo.
Yep.
And they'll be able to access information about the donor's education, family background. There's often a statement from the donor as to why the donor decided to donate sperm. So I've had many couples and women choose their donor on the basis of the feeling of the statement as opposed to other things.
Sure.
Like all of us, donors have a medical history, and that's collected and disclosed.
Great.
And also donors are screened for various conditions that may or may not be relevant to the recipient woman. So, for example, I'm a carrier of cystic fibrosis. I'm perfectly healthy, but if I wanted to choose a donor, I'd probably choose a donor who wasn't a carrier of cystic fibrosis to make sure that, kind of that was the right fit for me. So that kind of information is also available. And all our donors are screened for cystic fibrosis, spinal muscular atrophy, Fragile X.
Excellent. You've answered my next question. Very, very good. And I suppose anyone wanting to access the sperm has access to that information then.
Yeah, they do. And also we look at the donors and recipient status for certain viruses like CMV that are important in pregnancy, and looking at trying to create healthy babies and healthy families.
Perfect. And you touched briefly before on different ways of creating the embryo. So self-insemination versus IUI versus IVF. Can you just touch on sort of, again, when each of those would be indicated and what sort of the different success rates are for each of them?
Yeah, so self-insemination is a process that could be accessed in a private donor arrangement if you have a donor who can provide fresh, unprepped, unlab altered sperm when you're ovulating. And some people do that. It takes commitment, because your chance of getting pregnant if you're in a heterosexual relationship and you're having sex second daily around ovulation is going to be at best 20%. That's if you're kind of, relatively young.
Yes.
By the time you're, kind of getting to 40, it's about 5% per month, and it's a transition in between. So, it takes commitment and it takes a lot of time. Yes. And really, when you do have insemination of sperm into the vagina, kind of DIY style, it does expose you to infectious agents from your donor, who obviously won't want to give you anything, but they could. So
of course.
In terms of that, it takes commitment, and your chance per month would be relative to your age, somewhere between 5 and 20% of conception.
Yep.
So, and that would be from multiple inseminations in that month, ideally around ovulation.
Right.
What IUI does is it's a technique that combines generally gentle super ovulation with laboratory-based sperm preparation. And so what we do is we zip up the sperm in the lab, and we concentrate the best of the bunch so that we can then insert a little tube through the cervix right up to the fundus of the uterus, the top of the uterus, near where the fallopian tubes open, and we deliver that sperm right to the egg pretty much, you know, and just get the timing perfect. We generally combine that with ovulation induction, which is generally trying to give a little bit of follicle stimulating hormone. It's a drug we give in IVF, but at a very gentle and small dose. And the goal is to ask for an extra egg. It's really to ask for an extra egg. And it does increase the chance incrementally of getting pregnant. So both through asking for an extra egg, optimizing the sperm, delivering the sperm at the opportune moment of ovulation, within a short window of ovulation, we optimize the time to conception. The chance of IUI working in a month will also be age dependent, which is why the limitation is set and why women over 40 are not offered IUI. And you generally get a similar or slightly better chance of success per month than from multiple inseminations with vaginal insemination of syringe sperm insemination. Obviously, in IUI, there's a bouncer in that we're not going to let the donor pass the post if they're not giving us sperm of IUI quality.
Certainly.
A donor for IVF needs less stringent criteria to be met because we can inject a single sperm into the egg in the IVF lab, but that's the only time when one sperm, one egg ratio really fits. So we kind of we know that sperm acts like a team and has to break down the outer layers of the egg and get past all the cumulus cells so that one sperm can ultimately bind to the oolemma, which is the inner membrane, and get through and fertilize the egg. And then we have a calcium channel reaction so no other sperm can get through. But without that team effort at the beginning, you can't fertilize an egg. So you need lots of good sperm to reach the egg to get fertilization in nature and in IUI.
Absolutely. Great. And for someone who decides to hopefully get pregnant using donor sperm, from the time they make that decision, how long does the process actually take? You know, are we sort of talking a month? Are we talking 3 to 4 months with all the paperwork that needs to be done? What sort of time frame can people expect?
So it very much depends whether they choose a clinic recruited donor or a known donor, because with a clinic recruited donor, there's a bit of getting ready. So the donor has counselling, the donor has medical screening, and some of those tests we alluded to, the genetic tests particularly, and a karyotype, take about a month from when the donor has a blood test to when we get a result. The donor must freeze sperm, and that sperm is kept in quarantine for 3 months. That's to ensure that HIV seroconversion can't slip under the radar, and that's the period of time that it takes from HIV exposure to conversion. So all of that takes about 3 months minimum in terms of getting the sperm ready for use. And so a clinic recruited donor's done all of that before the sperm is offered to a patient, so it's a much quicker turnaround. In terms of, you know, getting ready and I guess some bureaucracy, apart from donor counselling, which I think is very important, we've recently in Victoria found that IVF has become a whole lot easier because we've just gotten rid of our police checks and child protection checks and a fair chunk of red tape there. So that's amazing.
Right. It is.
So it's going to be easier for donor conception, like it's going to be easier for all couples and women who need IVF. So that's a big step forward for Victoria.
Fantastic. Really, really good. And the other question, which I've had from a couple of people relating to this, is about cost. Now, I suspect a lot of that relates to whether or not it's an IVF cycle versus an IUI cycle, for example. But what sort of costs can people expect?
So, look, every clinic will be slightly different.
Yep.
And for Melbourne IVF, all the costs are very transparent on the Melbourne IVF website in kind of generic form, so I direct patients there. Ballpark to do an IUI cycle is about $1,600 out of pocket, and
Yep.
ballpark to do an IVF cycle with us is about $5,000 out of pocket. That's just ballpark figures.
Yep.
The specifics, I'll direct you to the Melbourne IVF website because it can change and it can depend on your circumstance. And
Yep.
usually with donor sperm, it depends on whether the sperm quality is ICSI quality or IVF quality, whether ICSI is required.
Of course.
Often with clinic recruited donor sperm, ICSI is stipulated because of the small allocate of sperm that is allocated to the woman. But if you've got your own donor, you would choose ICSI if it was required and not if it wasn't. So it would be different.
Perfect. That makes a lot of sense. I think that sort of covers the questions that I had about donor sperm. And if it's all right with you, I think maybe we'll move on to donor eggs now. And again, the questions will sort of be similar in nature. And which groups of people come to you wanting or needing donor eggs?
So, look, I would say that most people who come to me don't necessarily want a donor egg. They do sometimes need a donor egg.
Yes.
And I think there's a whole heap of stigma around egg donation or oocyte donation, unfortunately, because it is very much related in many instances to age-related female infertility. And no, we don't talk about age-related female infertility really, and there's a whole lot of different societal issues surrounding it that make it, systemically quite difficult for some women to have babies when we are at our biological prime from a fertility perspective. And many of us do have babies a little bit later in life, and some people just from their circumstances partner later in life and still want to have a family. And really, in our defence, women in their late 30s and early 40s are very, fit and well and able to parent and able to carry a baby, but not always able to have a baby with their own egg anymore. So usually there's a certain sadness that comes with the need for a donor egg. Often it comes from having tried IVF and been unsuccessful on multiple occasions with your own eggs. In IVF, there's strength in numbers. So, when a woman can make a whole lot of eggs and those eggs are good quality, that's going to, be a really great prognostic factor in IVF. And, we all have a limited, we have a limited amount of resources. We have limited financial resources. We have limited physical resources. We have limited emotional resources of what we can go through and what we want to go through to have a baby. And some people will choose to use a donor egg because they will get where they're going faster. And, you really want to choose a donor with a good prognosis who's ideally under 35, who ideally can make a lot of eggs in one go, who ideally has proven past fertility, in an ideal world has had her own family, because that's easier physically, emotionally and psychologically for everybody involved. And, an egg is really important. It's an amazing cell, but it's just a single cell. So an egg by itself can't make a baby. It needs to be fertilized and it needs to be nurtured. And I say to my patients who need a donor egg that, every molecule in that baby's body comes from your body. So yes, the DNA instruction manual comes from the donor, and the baby may look like the donor and may have certain physical traits and even behavioral traits that are genetic. But that baby knows no other mother, and that baby would not come into the world in any other circumstance. So, a donor egg is an incredible gift. It is an amazing sacrifice, and it allows families to form. So, I have many, many women in my practice who I've assisted through donor egg conception who have had amazing outcomes and beautiful, much loved, much wanted babies.
Absolutely, and I can think of a huge number of parents that I've helped deliver their babies as a result of a donor egg, and it's an incredibly special experience. And these people, will want it so much that they make the most wonderful parents. And I think it's a wonderful opportunity that you're helping these people to become parents as well through what you do. For women who need a donor egg, how is it accessed? I know that some people access eggs locally or, domestically rather, but a lot of patients that I've looked after who have had donor eggs have travelled overseas in order to get them. Yeah, and I just wanted to know sort of why some people would do different things and how easy it is to access donor eggs in Australia.
Yeah. Well, look, the ideal thing would be to access donor eggs in Australia, and there are some reasons why jurisdictions are different and what's available is different. So commercial egg donation works very well in other countries, but it is illegal in Australia under our current legislation, and that is contentious, and it may change. But at the moment, you cannot compensate a donor financially at all to give you an egg. And you've got to remember that becoming an egg donor is actually quite a big deal. You have to go through the equivalent of IVF to become an egg donor. So it involves 2 weeks of injections. It involves ultrasound monitoring. It involves an egg collection. It's not anonymous. You would go on a donor register in our state. And if the child wants to know more about you when they're an adult, when they're 18, they can find out identifying information about a donor. So given those circumstances, there are not an overwhelming number of donors who are volunteering to go through the process for people who are unknown to them. So usually my patients who I treat with donor eggs locally have a friend or a family member who is their donor and who has an emotional investment in their happiness and success.
Absolutely.
And that is their motivation to become the donor. I have also treated a lot of women who have gone overseas. That is not available during COVID times.
Absolutely.
But, there's nothing illegal about going to a jurisdiction where commercial egg donation is legal and creating embryos in that jurisdiction, getting pregnant in that jurisdiction, and returning to Australia for pregnancy care and delivery. And that happens a lot. And, that's really the argument for reform because, it's actually very expensive. It's a big burden on patients. And if they could have a donor egg locally, they would have one. It's just that they don't feel they have anyone they can ask to be their donor.
Definitely. And for women who locally don't know someone who can act as their donor and who are waiting for just an altruistic donation, how long are they looking at waiting? A number of years? Would that be sort of realistic?
Yeah, well, look, we do have an egg donor program at Melbourne IVF where you can have an egg donated. And we also have an embryo donor program, which, patients can wait in excess of a year. Sometimes it can be a lot faster. But it's really something that isn't like a kind of a stream of consistent, donations. It's often when patients have either decided to be a donor and contacted the clinic, more often they've frozen eggs for themselves and then chosen to donate them. And as egg freezing has become more popular, I'm sure in a decade's time there'll be a higher supply of altruistic egg donors from egg freezing. But egg freezing is a relatively new technology and women have only been doing it in high numbers for a short while. So that's not really a common source of egg donation today.
Absolutely. And what sort of cost are we looking at here? Is there a cost to actually get the egg, the gamete, or is it just the cost of the IVF cycle that
it's just
someone
the
pays
cost
for?
of the IVF treatment. So you can't buy an egg, and that's basically the whole point.
Principle, definitely.
The whole principle. So no, you wouldn't be charged for an egg. You wouldn't be charged for an embryo. It's about the cost of treatment. And generally what happens is that the commissioning couple or commissioning parent covers the medical expenses of the donor. And that's by convention.
Absolutely. So for a woman who is going to become a parent using a donor egg and her own partner's sperm, for example, given that it's actually the donor that's got to go through the IVF cycle to stimulate the production of the eggs, what's involved from a medical perspective for the woman who's going to carry the pregnancy and become the mother?
Yeah. So often what we do is we coordinate a cycle. So the first step when we're ready is to put both women on the pill so they're in sync, their cycles are in sync. And for the donor, they have a stimulated cycle. and that cycle ends at the point of egg collection. And for the
Yep.
recipient, we generally run an artificial thaw cycle, or it's not really thaw because it's the artificial, I guess, embryo recipient cycle.
Yes.
And at the point of, we coordinate the cycle so that they match in every way in the stage. So we start progesterone for the recipient on the day of the donor's egg collection, and we proceed with a fresh embryo transfer 5 days after the donor's egg collection.
Fantastic.
Yeah,
Excellent.
and any other embryos can be frozen for later, and that could be used for having more babies down the track.
Brilliant. Just very quickly to touch on donor embryos, is that something that's particularly common, or is it, under most circumstances, just a single gamete?
No, I have lots of patients in my practice who've had babies with donor embryos, generally single women at the age where they need both donor egg and donor sperm. But I've also had couples who've had donor embryos when they've had absolute infertility or the need for a donor egg. They choose to have a donor embryo. It's basically like adopting a baby at the very earliest cellular stage of life. There's not a genetic connection, but there's every emotional and physical connection to the baby. And in terms of where these embryos come from, they generally are donated by families who have completed their family through IVF and have had an excess number of embryos to their family needs. And so it is quite common that there would be full siblings in the community from a genetic perspective. That is something to think about, that when the child is an adult, there may be full genetic siblings in the community. And often these families are happy to go on a donor, well, they have to go on a donor register, but they're happy to go on a voluntary donor register ad vata. And sometimes communication can happen earlier than when the child is 18 years. In terms of, families that have embryos they're not going to use, I can tell you that it is a lovely thing to do. There are some really beautiful family circumstances that have resulted in my practice from donated embryos, and some people do feel like that they couldn't discard their embryos. They might have a connection to them and feel that they can't let them go, but they'll be happy for someone else to raise a child. So there can be also known donation circumstances. I once had a patient who was having a chat at a dinner party with a family friend. And they ended up having one of their embryos and having a baby. So,
unbelievable.
True story.
The timing was perfect.
That's it. So you can have a known arrangement as well, and that does happen.
Great. Excellent, Raelia. If it's all right with you, and I thought we could move on to gestational surrogacy. At the moment, I've actually got four families who I'm looking after, either in the process of becoming surrogates or pregnant currently as surrogates. And again, it's a very unique but incredibly special scenario because, you've got so many people involved at such a happy time, which is really wonderful. What are the main indications for gestational surrogacy?
Sure. Well, look, there are different categories. So same-sex male couple is a very common reason. Any reason that a woman can't carry a baby. So, for example, I've got one of my patients who is prepping for surrogacy. She had a hysterectomy for severe endometriosis management with pain that could not be managed any other way, and subsequently, years down the track, decided she might decide to have a baby because she's in a relationship, so they will need a surrogate. I have another patient whose baby must be about 2 now, who had a genetic condition, meaning that carrying a baby would have been dangerous for her. I have another patient who has a severe kidney condition, who would significantly be at risk for many reasons carrying a baby. So look, there's lots of medical reasons. Sometimes there's a syndrome called Mayer-Rokitansky-Kroster-Hauser syndrome, where you can be born without a uterus, but you have ovaries and you can have a baby, but you just can't carry the baby. You might have had a cancer of the uterus and needed a hysterectomy and still be able to have a baby, or radiotherapy because of cancer of the cervix, which fortunately is becoming less common with vaccination against HPV, but still happens. And so many reasons that you might need a surrogate, and it's amazing when it works well, and it can be beautiful.
Absolutely. And in terms of accessing surrogates, again, it's an altruistic process, isn't it? So
Yeah, so in
most of the
Australia,
ones that I've
yes.
seen know each other very well, either family members or close friends. Is that sort of a similar thing to what you see in your fertility practice?
Yeah, well, look, there are also people who do travel overseas for surrogacy arrangements in
Hmm.
jurisdictions where it is legal to have commercial surrogacy arrangements. But in my practice, I don't tend to deal with patients in that circumstance. As often more I deal with patients who have an altruistic arrangement that can be facilitated here.
Yep.
So
Yep.
often it is a relative or a friend of
Hmm.
the commissioning parent or commissioning couple,
Hmm.
and it is out of the goodness of their heart, and it's an incredibly
Yep.
special thing to do for a family.
It
Very
certainly is.
difficult.
Ah, huge. And what's the process involved? So again, sort of as a fertility specialist, what's your
Mm.
role in creating the family?
Well, often the embryos are created before the surrogacy arrangement is kind of in place. So
Yep.
what happens first is we make the embryos. And then in Victoria, there's a patient review panel process that needs to be
Hmm.
navigated, and we
Yep.
must apply for a surrogacy arrangement that has to be
Yep.
approved. And it's really to make sure that no one is being, kind of coerced into an arrangement, and that it's also something that is not going to go kind of badly at the level of when it's time to kind of have the parenting order, where the
Definitely.
commissioning couple become the legal parents of the child. Because in Victoria, as in all over Australia, giving birth to a baby makes you the legal parent unless you have that parenting order signed. And so,
Yes.
that has to be sorted out. And it can be, you can imagine that things could go wrong. So there's a
Sure.
intense counselling process and legal process to make sure that everything goes well.
Absolutely. And as an obstetrician, I've often sort of provided supportive documentation saying that I think that it's a good arrangement, and that the gestational surrogate is medically well enough to act as the
Sorry.
surrogate and to carry the pregnancy. Absolutely. Um, I think what I find sort of very interesting about this whole topic, and that you will see sort of at the forefront more than I do, is what a difficult discussion it must be to have with parents who come to see you, or couples or single women coming to see you desperately wanting to become parents, and sometimes having to say to them, I don't think the best way to do this is with your own egg or your own sperm. And how do you sort of approach that discussion? Because I think you summed it up beautifully before when you said, carrying the baby makes you the parent, and that, in the donation sort of field, different with the surrogacy. But how do you broach the topic with people? Because I think it's a very challenging one to start.
Yeah, look, openly and honestly. So, look, I think it's nobody's first choice to have a baby with a donor egg.
Yeah.
Donor sperm is rarer. There's lots of people who are happy to have a baby with their own egg
Yeah.
and donor sperm. And, we only ever give 50% of our genetics to a baby, no matter what the
Yes.
circumstance. So,
Yes.
in terms of donor egg, it's often because a woman has either gone through an early menopause. I have lots of patients in my
Hmm.
practice over the years who unfortunately have suffered premature ovarian insufficiency, either because they've had
Yeah.
a cancer and treatment for a cancer, or just because they have a fragile X premutation. There's so many different reasons that you can go through early menopause. And it's worthwhile pointing out that the average age of menopause is 51, but the lower limit of the normal range is 40. And there's
Yes.
plenty of women trying to have babies in their 40s,
For sure.
and it's normal, although unfortunately unlucky and at the lower end, but you call it
Yeah.
normal, you don't call it premature if
No.
menopause happens at 40.
Absolutely. I think in
So,
my practice, I have as many women who are pregnant in their 40s as I do in their 20s. So, I completely agree with you. The balance has very much shifted.
and it's humbling to think that 50% of women over 40 will need a donor egg if they want to carry a baby.
Wow. Very interesting.
So it's a large number, and there are far more women who use a donor egg to have a baby than who put it in the shop front window, and tell
Yeah.
everyone about it. That's because there's a huge amount of stigma about the subject still. There's a
Yeah.
huge amount of stigma,
Yeah.
unfair stigma, and it's not really normalized. If you go to the US, it's a very
Yes.
different attitude, and
Yeah.
I think it's also because of our Medicare system, you know, being very different to their system. You know, over there, it's pretty black and white in
Yep.
terms of the fact that, you know, the medical subsidy for IVF is basically nothing. And if you don't
Yep.
have insurance, you know, an IVF there costs about 20,000 US for a cycle of IVF. So,
So
you know, if a
expensive.
woman has a low prognosis for success, she's directed straight to donor egg, don't pass, go, you know, because, you know, the clinics have to report their success rates. They don't want to report a, you know, 2% success rate for someone who's 43. They don't want to
Yes.
report that. They want them to
Yep.
use a donor egg from someone who's 21. And
100%.
so that's what happens. And it's actually not
Absolutely.
acceptable to use donor eggs in that context. It's talked
Yep.
about, it's a done thing, lots of people do it. You know, we're
Definitely.
talking now more about women freezing eggs when they're younger, and that's still something that's amazing that you can do for yourself if you're not ready to have a baby and you're concerned that you might be getting older. You know, it's a very reasonable thing
Yep.
to create a resource for yourself with some frozen eggs, because that's basically like putting your hand up to be your own donor if you need one later on in life.
Definitely.
And definitely a good thing to do if you're on the fence and not sure if you want to have a baby or when you want to have a baby. And the
Definitely.
ideal time to freeze eggs is definitely under 35 and ideally
Right.
probably closer to 30.
30. Yep. Definitely.
So I say if you're
Absolutely. Well,
turning 30 and you don't know where you're going in terms of fertility, have a think
yep.
about it.
Great. And I think you know, you've summed up the reason for which I wanted to have this chat tonight. I think there is a lot of stigma about a lot of these different things, and I was hoping that we might be able to break that down a little bit and try and normalize it, because at the end of the day, for, you know, anyone who wants to become a parent, there are different ways to achieve it. And, you know, if there are things that we can do to help, I thought that'd be a great thing. I'm going to ask you two more quick questions before we wrap it up for tonight. There's a great question on the screen. So, is there an age limit for the intended mum to get a donor egg?
There's not a legal age limit. It's a consensus age limit in our clinic. And once you are 51, we don't support a pregnancy in our clinic at Melbourne IVF.
Mm-hmm. No worries.
And that's for medical reasons.
Absolutely. And what about the use of a gestational surrogate? Is there an age limit to how old a surrogate can be to be supported by an IVF clinic? Same age, 51?
51.
Perfect.
Yeah.
Not a problem at all. Excellent. Well, once again, you've got a knack for summing things up and sort of explaining things in such a good way. And I'm so grateful for your time again. And as I've said before, you know, I couldn't recommend you highly enough. We have got a lovely 13-month-old baby at home courtesy of you. So thanks once again for everything. And hopefully we'll be able to chat again soon.
Greatest pleasure. Nice
Thanks a lot,
chatting to you.
Rayleigh. Have a good night. Take care.
Bye.
Bye. Bye.
Good night.